So, hello and welcome to this episode of Rigicon Talks. Today we will focus on penile implants in transgender patients, addressing pre- and post-operative care, surgical techniques and long-term considerations. We are delighted to be joined by two distinguished experts in urology, Mr. Donnelly and Dr. Marco Falcone. Mr. Donnelly is a prominent urologist based in the UK. He specialises in complex cases of erectile dysfunction and penile implant surgeries, but he has extensive experience in both cisgender and transgender patient care, with a focus on providing comprehensive post-operative care and long-term implant management. Mr. Lee has contributed significantly to the understanding of the unique challenges faced by transgender patients undergoing prosthetic surgery. Dr. Marco Falcone is a highly regarded urologist in Italy. He is known for his work in reconstructive urology and penile implant surgeries, particularly in transgender patients. He is a leader in the field of gender-affirming surgery and has developed techniques to address the anatomical and reconstructive challenges specific to transgender individuals. So Dr. Falcone is also active in research, focusing on improving surgical outcomes and post-operative care for transgender patients. So thank you, Dr. Lee and Dr. Falcone, for joining us today. So our discussion questions, the first question is on post-operative care. So Dr. Falcone, can you walk us through the key considerations in preparing a transgender patient for penile implant surgery? And what are some specific challenges faced during the pre-op phase that maybe differ from cisgender cases?
Well, it's a very interesting question. I mean, the problem as surgeon that we face for this kind of implant surgery is surely that the anatomy of a phalloplasty is totally different from a cisgender penis. So essentially, before undergoing in the proper manner and in order to increase the satisfaction rate of a penile implantation phalloplasty, we need assess and prepare the patient to get in the best anatomical features for the implantation to be suitable for the implantation. We all know that when we go for a gender-affirming surgery in transgender men, phalloplasty is a very difficult surgery. It's very challenging. There's lots of complications possible that are mainly related to urethral reconstruction. So what we personally suggest is to assess the quality of micturing, to assess the quality of the phalloplasty itself. And I think that the key point is to address a possible complication related to the phalloplasty or to urethral canal before undergoing an implantation into a phalloplasty. Because this become extremely difficult to address surgeries in a later stage when the implant is in. So I think that a specific visit, assessing the quality of the phallic reconstruction, inquiring the urethral reconstruction, the quality of micturing is extremely important. Another thing that I found extremely important is to specifically address the specificity of the implants in transgender men. There are specific features and is an expectation. I think it's another key point as that we highlighted and widely discussed in preparative settings. So we need to be clear with our patient what are the results, the aims of this surgery, what they should expect from themselves for the penetrative sexual intercourses and for their partner. So I think these are the most important features that should be discussed before every kind of implantation into transgender men.
That's wonderful. Thank you. So our second question is on post-operative care and recovery. So Mr. Lee, post-operative care is critical for the success of penile implant surgery, but what would you consider are the key long-term maintenance tips for transgender patients?
Thank you, Robin. And I think it's really great that Dr. Falcone has started off talking about the pre-op, because really the post-op care starts with the pre-op care. So if the patient's been well counseled, they know the type of device they're getting, they've had a feel of the pump, they feel they can use the pump, that it will make the postoperative care a lot easier. At our center, we keep our patients in for a night, so overnight, and they usually have a catheter and a surgical drain to prevent any sort of bleeding or hematomas forming. So I always warn the patients about this, and then, but often before they go home, all of this would have been removed. And a major difference that we normally do in transgender implants is we tend to keep the implant inflated for a duration of time, between 1 to 2 weeks. So I always tell the guys, make sure you bring some track pants, or, don't wear skinny jeans, for example, because you'll be leaving the hospital with a partial erection. And if you have something tight, then it's going to be a bit awkward for the patient. So that's something I always mention when I speak to patients beforehand. And also, I think, it's really important in the postoperative period for them to just take it easy, not to do any sort of strenuous activity, any exercise, because if they do too much, they can also damage the device. And lastly, in terms of maintenance, I do ask them to keep the implant inflated, or at least test the implant out every 1 to 2 weeks, just to make sure it's still working, and also to maintain the position of the caps. But I think we'll cover that a bit more later on.
Excellent. Okay, thank you. So our third question is about surgical techniques. So Dr. Falcone, the penile implant surgery in transgender patient involves quite unique anatomical and reconstruction challenges. But can you explain the sort of surgical techniques that are tailored for transgender individuals and how they might differ from those used in cisgender patients?
Well, thank you for the question, Robin. So this is another interesting topic. So the big difference from a phalloplasty from a cisgender penis is the lack of some anatomical structure that are normally deemed to be necessary to put a cylinder in of an implant. So we are actually facing a unique anatomy where we don't have the basic anatomical issues that normally are needed for an implant. So the point is that to give enough bulk and rigidity to a phalloplasty, we need in a certain manner to put some kind of a stiffener inside the phallus. So this is the basic point. And the fact is that if in a normal penis, we normally have what we call the corpora cavernosa, that are two tubular structures that we can use as an envelope for our cylinder. So essentially we open this anatomical structure and we put the cylinder in, and there is a stability and a protection that is given by this anatomical structure. When we deal with phalloplasty, we essentially have skin, subcutaneous tissue, so very soft tissue. So the first point is dilation. So we need to do some space where we do not have a proper anatomical landmarks. So we need to be very aware of where are the vascular structure of the phallus, and pay attention during the dilation, because we may potentially consider to do some kind of a damage to the phallus. So this must be done by experienced surgeon that start from the phalloplasty and get to the final step of the reconstruction. We need to give stability to the cylinder. We cannot put just a stiffener into a phallus. If there is not a kind of fixation, the penetration won't be possible. So essentially we need to attach the cylinder in the proximal part to something that is stable. And the only anatomical structure that is stable is the pubis, so the bone. Essentially what we need to do when we face this kind of surgery is to fix the cylinder of the phalloplasty, of the penile implant, to the pubic bone of the patients. So to do so, we have different ways. Either we use a cisgender implant. At that point, we can pass some kind of stitches through the basic base of the cylinder. Eventually, use some kind of protection. We can normally use some kind of prosthesis that they normally use for vascular reconstruction. That's tubes that we can use to as an envelope in the proximal part, and also to put on the tip of the cylinder to avoid a kind of pressure or extrusion possibility in the long term. Another option is to use some kind of we call ad hoc created implants. So hopefully engineering and research is evolving. So in the last years, there are few implants that have what we call a base. So they have a structure at the base of the cylinder that allow us to pass a stitch through the bone and then give stability. So this is surely something that is new. It's extremely interesting, very helpful for us as surgeon, and I think it may make the difference in the long term as outcomes. The last peculiar tip that we need to consider is the position of the pump. Normally in a cisgender male, we put the pump in between the two testicles. In this kind of patient, what we like to do is to use the pump as a testicular prosthesis. So we put essentially the pump on the right side of the scrotum, and it will simulate aesthetically one of the two testicles. And we were going to put a testicular implant on the other side to give symmetry. So I think these are the main specific issues related to technical surgical technique that I normally discuss with patients in pre-op settings.
Yeah, thank you for that. So the next question is about implant maintenance. So Mr. Lee, what are the most important long-term maintenance tips for transgender patients with penile implants? And are there specific issues that are more common in this population that need special attention?
Yes, certainly. And, Dr. Falcone has already done half my work for me. So as he mentioned, with transgender patients, they aren't born with specific structures that we would normally expect to use when implanting a penile prosthesis or an urethral device. So in these patients, we have to use grafts, and because of that, things can become displaced. And in particular, with the base of the implant, if we use, say, Dacron or specific graft materials, we tend to also put one in the top, in the cap. And this is just to keep the implant in place at the top of the phallus, and also helps to sort of protect the tip of the phallus so that the implant doesn't sort of erode or poke through the skin. So the issue there is that if they don't keep the implant or use the implant regularly, this cap can become displaced, or the implant cylinder can fall down. If that happens, then they will need a revision of the cylinder to reposition it in the correct place. Also, because they haven't been born with the corpora cavernosa, as mentioned, they don't have this protective structure around the cylinders and the tubing. The tubing is a lot more palpable, so you can feel the tubing in these patients, unfortunately. But that's because there's just not as much space for us to hide the tubings. So it's really important that patients know about this and they avoid trauma to the genitals, because any trauma to that area potentially damage the cylinders, the tubing, the pump, or even disrupt things and malposition things. And that means they then need further surgery to revise this. So that's basically the main points. But it's important really to remember that they do need to just pump this up, regularly to maintain the position. That's something that unfortunately people don't always pay attention to, because they say it's in there, I can forget about it, I'll just use it when I need to, and then they find that things have shifted.
Yeah, so they're responsible for their own maintenance, that contribute to their own success, really. So the next question is on complications and complex cases. So Dr. Falcone, transgender patients may face additional complications due to the prior surgeries or anatomical differences. But what are some ways to mitigate these risks and ensure a successful implant procedure?
Well, I would be very quick on this answer. I think that there are three aspects that need to be underlined and stressed as extremely important to avoid possible complication. First of all, we need to know the anatomy of the phallus. We know that there are several flaps, so several techniques that can be used to address phalloplasty. So I think that the implant surgeon should be a surgeon that is very well informed about the techniques that have been used in the first stage of reconstruction. Because if we don't know how the phallus has been constructed, we may be potentially make kind of mistakes and be potentially leading the phallus itself. So pay attention. and be referred to surgeons that know very well their job. So implant surgery in transgender men is not for everyone. Should be reserved to tertiary referral center, to surgeons that do transgender gender affirming surgery, and they are very well formed, specific formation on this topic. Third point, as Dolly has just highlighted, the maintenance. So it's not just a matter of what happens before and during in the operative surgery, the implantation surgery. It's a matter of how the implant is considered in the post-operative setting by the patient. So it's extremely important to pump it out every day and to be very careful during penetrative sexual intercourses. Try to be less traumatic as possible. Use a lot of lubricant gels during penetration. Pump the prosthesis at its maximum during sexual intercourses. Otherwise, you may potentially damage the cylinder. So that's the point. But despite the techniques, the experience of the surgeon, we all know, and that's something that I clearly discuss with my patient, that the complications in this kind of surgery are still extremely high. So no matter what we do, they may incur in mechanical failure. So the prosthesis may break at a certain point, or may get infected. This is something that we may consider in a decade. Over a decade, it will be very, very common. So we are far away from the perfect operation, and we must be honest about that. But we are improving, and that's the most important aspect.
Yeah, excellent. Thank you. The next question is in relation to partner and relationship impact. So, Mr. Lee, penile implants can affect relationships, obviously, but how can surgeons counsel transgender patients and their partners on the potential changes in sexual function and intimacy post-surgery?
Yeah, I mean, that's an interesting question, isn't it? Because it really is a complete change for the trans person, or non-binary person. Essentially, prior to the erectile device and penile prosthesis, they are not able to really have penetrative sex. So this has, for one thing, it's allowed or will allow them to engage in that. But remember, these individuals were assigned female at birth, so they did not go through adolescence, where you try things out, with your first boyfriend, girlfriend, and you work things out in that way. And so they have to do this while often an adult, and they've not had the experience. So I think what I encourage my patients to do is to take it slowly, and just to learn, have a trusted partner so that they can both learn to use this problem, this new device together. Secondly, also, I think it's very important to understand that practice makes perfect. So I always tell my men, you want to be really good at using the pump, and really good at deflating, so that when you are engaged in that situation, you're not, fumbling around and, I can't quite get it going. And that just adds the anxiety, so I say practice does make perfect.
Wonderful. Thank you. So the question is really on innovations and future directions. So this is for both surgeons. If I can start with Dr. Falcone. So looking forward, what innovations or advancements in penile implants do you see being particularly beneficial for transgender patients? And how might these developments improve the surgical process or the patient's quality of life post-implant?
Well, as a transgender surgeon, we face problems during the implantation, right, due to the fact that most of the implants, as we said before, are not dedicated to this kind of operation. So, first of all, the first big step would be, and partially is ongoing, is to have a dedicated implant for transgender patients. Because for us, transform in the OR a cisgender implant with 2-cylinder and remove 1 cylinder and create, as we said before, protection at the base of the sock. It's something that surely is complicated, increase the operative time, potentially increase the possible risk of complication. So this is the first issue. Then I think we should also work on materials. As we said before, the problem is of the mechanical reliability of this implant is possibly mostly related to the fact that the cylinder does not have a proper protection. So there's no a structure that protects the cylinder. So the solicitation, the mechanical solicitation are probably much higher than a cisgender patient. So working materials and getting perfection resistance in the proper parts of the implant that would probably make a difference, a big difference in the history of this patient, reducing the possible risk of mechanical failure. I'm surely we share with Don the same ideas of how an implant should be in transgender patient, but I will leave the next of the answer to Don. Otherwise, I will say everything on behalf of of the two of us.
So over to you, Mr. Lee. So,
Please.
Advancements in implants, do you think would benefit transgender patients, and how might that improve the outcome and the quality of life for these patients?
Definitely. And thank you, Marco, for giving something for me to say. Look, I think, we know that the risks are higher. The risk of infections are higher, mechanical failure. So what we do need are robust implants, and for example, with the Inflatable 10, there's the fourth silicon sheath, for example. Things like that will really hopefully make the device more robust and prevent mechanical failure. And we probably need the things where perhaps the antibiotic elution from the device comes out for a longer period, so that it prevents infections for a bit longer. Another thing I thought about, often when we try to put the pump in, sometimes the neoscrotum from the scrotoplasty isn't very capacious. And that's basically because of the reconstruction from the previous labia majora. So something like an EIPP or Wi-Fi enabled, prosthesis would be really helpful, where you don't need to have a pump and you can just sort of press a button. But obviously that comes with its own concerns of like privacy and safety, cyber hacking and all of that. So I think that's really something that will come in the future, I'm sure, but maybe not in the immediate period. But I think these are all things that potentially may make devices more suitable for transgender and non-binary persons.
Thank you. So thank you, Mr. Lee and Dr. Falcone, for sharing your valuable insights today. Your expertise has provided a greater and deeper understanding of penile implant surgery in transgender patients. To our audience, thank you for joining us on this episode of Rigicon Talks. We hope you found this discussion informative, and until next time, take care.